with the part two, this of the sexual self. So these are the different phases of sexual response. Okay. So on the first phase, we have excitement phase. So this is the beginning or the initial um, occurrence in the sexual intercourse. Okay. So there are some physical changes that happen to the body, like for example, increase in the skin temperature. So there will also be flushing, swelling of the distensible parts of the body. So what are this? We have the male sex organ or the penis, and then the female breast or the nipple itself. Okay. Other physical changes includes rapid breathing, and then secretion of genital fluids that would serve as lubrication, vaginal expansion, and then the increase in muscle tension. Now, if the stimulation is continuous, then this is known as the plateau phase. So the plateau phase will eventually lead to orgasm. Okay, this orgasm is known as the sexual climax. All right, and there are also some changes in the physical and also in the disposition or emotional disposition of the person. Okay, so there is a feeling of abrupt, intense pleasure. Okay, rapid increase in the pulse rate and the blood pressure, and also the spasm of the pelvic muscles, which can cause contraction of the female reproductive organ. And for the males, there is an ejaculation of the semen, which contains the sperm cells. Okay. Now, after the sexual climax, it will lead to resolution phase, although there is a slight difference between this phase, okay, between male and female, because for female, there might be an occurrence of multiple orgasm, okay, or females might not experience sexual climax at all and they will lead already to the resolution phase. But for male, after the sexual climax, okay, it will eventually lead to the resolution phase, which is known as the resting phase. Okay, so this is the last stage, and it refers to the return to a normal or subnormal physiologic state. Okay, so let us proceed now with different sexual problems. Okay, so we have premature ejaculation of semen. Okay, so this is more common among young males, and this is usually because of too much excitation and pressure or tension, sexual tension. It could be because of sexual deprivation, too much excitement. Okay, so excessive tension in male who has been sexually deprived might cause premature ejaculation of semen. Okay? And for erectile impotence, so usually this has a physiologic origin. All right? Uh, for older males, there might be some organic causes. Let's say, for example, they are under medication, they have this kind of illnesses that affect the erection of the male reproductive structure. So, erectile impotence is the inability to have or to maintain an erection for sexual intercourse. Okay? And then we have ejaculatory impotence. So this is the inability to ejaculate in coitus. Okay? So this is rare and usually psychogenic in origin. So most probably there might be a psychological reason or psychological trauma that has been associated with this kind of sexual problem. And we have vaginismus. So vaginismus is the contraction of the female reproductive organ of the muscles inside there, making it difficult for the male reproductive organ to penetrate inside. It might be painful or it might be impossible at all. Now, if the penetration happened, it might be locked inside or stuck inside. So that is vaginismus.